Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're happy to be coming to you today from ASCO 2023. With me today is Dr. Andreas Saltos, who is a lung cancer expert at Moffitt Cancer Center. Dr. Saltos, thanks so much for being here with us today.
Thank you for having me.
Yeah, so you're doing a couple of interesting presentations. Can you tell us about those?
Sure. So first, we shared results from a phase 1 first-in-human study using an oncolytic virus in solid tumors. So our virus, MEM288, which is an adenovirus, expresses CD40 ligand and interferon beta, which are two activators of the immune response. And this virus was developed through a preclinical partnership along with Dr. Amer Beg, who's an immunologist here at Moffitt. And it was demonstrated that this virus was able to stimulate dendritic cell trafficking into tumors, antigen presentation, and ultimately effector T-cell infiltration into tumors, leading to not only response in injected tumors in a preclinical model, but also abscopal effect into non-injected tumors. And so we launched this phase 1 first-in-human study. It was at Moffitt and at Duke as a second site. And we recruited patients with a variety of solid tumors, predominantly non-small cell lung cancer, who were refractory to checkpoint inhibitors and standard chemotherapy. Patients enrolled had to have a tumor that was amenable to an injection with our virus, and they received a virus injection every 3 weeks, as long as tolerated. And we also collected biopsies before and during treatment to look at gene expression changes in the tumor microenvironment, and T-cell infiltration.
Wonderful. So how well did it work?
So we demonstrated that the virus, most importantly, was feasible and tolerable. We were able to successfully treat all patients, and there were no dose-limiting toxicities at any of the doses that we explored. The most common adverse effects were fatigue, flu-like symptoms, fever, chills, usually for a day or two. So very well tolerated. We saw about a third of patients have significant shrinkage of the injected tumor, and that was typically associated with a robust T-cell infiltration. And we also demonstrated in a select number of patients that there was an expansion of TCR clonotypes that were tumor resident at baseline in the periphery. So we think we're seeing an exciting evidence of immune response. It hasn't quite generated a abscopal clinical response that we're hoping to see. We have seen a few patients with disease stabilization, a few patients who've had great responses to subsequent chemotherapy after treatment. But what we're really hoping for in an expansion part of the study that's planned is by combining our virus with PD-1 therapy that we'll see better clinical responses.
Wonderful. Well, good luck with that, and tell us in general what's exciting here at ASCO for lung cancer.
Yeah, so at ASCO 2023, we've seen already the perioperative therapy with pembrolizumab and chemotherapy, demonstrating a significant event-free survival benefit for patients with resectable non-small cell lung cancer. This adds to some of the data we've already seen with neoadjuvant therapy in lung cancer, and I think it really tells us that the next frontier in resectable lung cancer really is neoadjuvant immunotherapy approaches. We've seen this with other tumor types, like in melanoma, and I think lung cancer is no different.
Wonderful. Well, Dr. Saltos, thanks so much for being with us here today. Dr. Andreas Saltos, lung cancer expert at Moffitt Cancer Center.
Thanks.